Pressures on the NHS obviously have been there for many years in terms of resources and providing care. And in Harrow, we've always looked to be innovative in providing different kinds of services. The traditional systems are such that patients phone up, they book an appointment. Now that might not necessarily be the right person or the right care pathway for them, but there's no way the practice can predetermine that using traditional systems. We're pleased and proud to have introduced Klinik software into Harrow GP practices.
I first of all log on to the surgery's website.
The boxes are reasonably self-explanatory.
If you've got a smartphone, you can do it on the go, anywhere.
And in my experience, it's probably 4 to 5 pages. And you can see where you are. You can go back at any time that you want to.
And if I want to do it at 2 o'clock in the morning, I can. I haven't got to say, no, the surgery's closed, I've got to wait till tomorrow.
I found it relatively easy to use.
When the patient enters their symptoms, the AI engine analyses the data that's been put in, and it suggests further symptoms and further things that the patient might wish to enter. At the same time, it analyses that data and provides a provisional diagnosis for the clinician to consider. It also provides a red, amber and green traffic light system so that the patient query can be classed as urgent, non-urgent or emergency. We can then group the urgent ones, ring them back straight away, and we can plan the workload throughout the day and throughout the next few days even. So it allows us to use our resources much more effectively than we ever could.
My experience is that because you have the opportunity to say what the symptoms are, the person that phones you back, in a sense, has an answer. They know who you need to see, and they know how quickly you need to see the person.
There are lots of systems available, and we actually held workshops with a lot of different providers. So some of the systems are based on what I would call analog processes, where there's a predetermined pathway that's been developed by a clinical group, but there's no real-time artificial intelligence analysis. Other systems were purely AI-driven. Now, that didn't allow the clinician to necessarily have as much input as we would have liked. Klinik has a balance whereby there's a real-time AI engine that analyses the symptoms. The patients are presenting their symptoms in as close a manner as you can get to sitting in front of you and narrating a history. But the clinician can either choose to accept or adapt the AI outcome. So I do think that we made the right choice in my general practice. We started this 6 months ago. We found the majority of our patient contacts now are through the Klinik system, and that allows us to respond to them appropriately. Most of the contacts are dealt with by telephone. A significant proportion are dealt with by the administration team so that a clinician doesn't even have to get involved, and a small percentage are seen face to face and the problem dealt with that way.
Certainly I found that it's much quicker, it's much more targeted, and frankly it wastes less of my time before getting to a solution.